Hello, everybody. My name is Spencer Adams. I'm a student at ECPI University. Currently, I'm enrolled in the online RN to BSN program, and this is going to be a video on my practicum project. So, like I was saying, this presentation is going to be a brief overview on the work I did for my practicum project. I'll be going over the various project goals and critiquing the work that was completed. The goal of the practicum project was to educate graduate registered nurses in an emergency department on how to care for and manage patients presenting um, to the unit with burns, sepsis, acute coronary syndrome, stroke, and respiratory distress. So my objectives are listed here. At the end of the presentation, the goal was to have the learners to be able to select the correct multiple choice response that identifies the management of a burn patient, describes risk factors for septic patients, describes the diagnosis of acute coronary syndrome, discusses appropriate treatment of a stroke patient, and identifies practical ways to manage acute respiratory distress patients. My completion of strategies. First, I researched up-to-date peer-reviewed literature on the 5 topics and created an annotated bibliography that summarized my findings. Next, I looked up my organization's policies regarding the topics to share the data within and create an appropriate guide that could be used on the unit. With the data I found, I was able to create a lesson plan that would discuss the 5 topics in depth and quiz the participants on their knowledge after witnessing the presentation. When I began the project, the goal was to create a handbook that could be kept after the presentation. This ended up becoming a PowerPoint presentation with slide printouts instead, being shared during the presentation. The presentation was over 5 topics, so when presenting, the lesson plan was created and information that was presented was in the same format for each topic. Cause and risk factors, signs and symptoms, diagnosis and treatment. Any variation I had to this was based on the topic itself and if it required more in-depth information. An example would be the types of burns or types of strokes. This presentation did successfully meet the goals it set out to. The average score was a 9 out of 10 on the quiz, and while the feedback from the application of the handbook to practice was mixed, I believe this was due to varying experience levels of the nurses. We did not have a new cycle of graduate nurses to take this quiz at the time, so a lot of the nurses already knew and understood the information that was shared and didn't need to refer back to this presentation as they encountered these types of patients. The application of this practicum project, the presentation can be utilized as a reference tool and serves as a foundation for further knowledge to be built upon. It doesn't need to be all-encompassing for the various diagnoses, but rather it highlights some important information and things to know about each topic. The value of the project, this has made me more confident in researching and sharing information that I've found, especially with those coming into the profession. The presentation and quiz both have had helpful information that I can speak on more in depth with those who may have questions about the management of the 5 topics that it consisted of.